Welcome everyone to another edition of Implant Minute. On today's topic, the aesthetic implant. So what happens over time on some of our cases as you come back and you see your patients on recalls? You may find a gray discoloration around your implants. What do you do next in those cases? How would you deal with this in the aesthetic zone? Or collapse around a premolar implant? In the absence of symptoms, what do you do next? What do I mean by absence of symptoms? That is crucial because that's going to determine if it's simply a case of tissue augmentation or peri-implant disease. Because if you have peri-implant disease, you cannot simply augment with bone and tissue. You have to get rid of the actual infection that is occurring underneath the tissue. But in the absence of symptoms, there's no blood, there's no discharge, there's no BOP, bleeding on probing, you can use tissue as your solution. So you can see here on these cases, you have collapse around those implants, and tissue is our answer. And the timing of tissue grafts really depends on when you're planning to do that implant. You can do your tissue grafting before implant placement, at or after. Today we're going to focus on a very nice article, which is the aesthetic tunnel exposure. And this is an article by Dr. Gluckman, Maurice Slama, and Jonathan Dutoit. And the focus of this is on before implant placement. So let's say you're looking at a case and the tissue's thin, or maybe you've buried that implant with a cover screw. Before you go in and expose that implant, you're going to go ahead and augment that tissue. And through the tunneling technique in place, we're introducing a connective tissue graft. This can be taken from the tuberosity region or palate. If the patient has a good tuberosity source, that's always a good option because it does hurt less also for the patient, and you get very nice thick tissue quality in place. With this technique, you're introducing the tissue graft through a tunneling procedure and grabbing it on one side to secure it in a coronal position, and then going to the other side and securing it again in that position. Simply leaving that in place for a number of weeks, 4 to 6 weeks, and then going and exposing your implant or placing a new implant allows for a much longer lasting implant procedure in place, ensuring that if you have that shine or gray through color of that implant, that despite bone loss, we don't end up with potential an ugly aesthetic complication on our case in the future. So this is a great solution. Next time we're going to talk about implants that have already been placed and how we can deal with that same kind of procedure for dealing with those implant complications. And see you guys on the next Implant Minute.